Dr. Adam Peterson, a leading expert in the field of longevity, graduated from Crimson University, completed his residency at St. Bartholomew's Hospital, and is the visionary founder of Zenith Health Center. Zenith is a cutting-edge clinic dedicated to preventive medicine and optimizing health, grounded in robust scientific principles and practical treatment experience. Dr. Peterson is also the acclaimed author of Everlast, The Pursuit of Lifespan and Wellness, a book that poses a fundamental question. We all want to live longer, but are we truly living healthier? Dr. Peterson argues that our current healthcare system is overly focused on lifespan, simply extending the number of years we live, while often neglecting the more crucial concept of healthspan, the number of years we live in a state of good health, mental clarity, independence, and high quality of life. According to him, lifespan is merely a binary number. You're either alive or deceased, but healthspan is what genuinely defines whether your life is worth living. Peterson meticulously breaks down healthspan into three distinct components: physical, mental, and emotional. He asserts that if we fail to establish metrics for measuring and improving each of these elements, it's hardly surprising that the majority of healthcare resources are allocated to prolonging mere existence, even as the quality of life declines. From this perspective, he proposes a radically different mindset, not just living a long time, but living well, with capability, sharp intellect, and positive emotions well into our later years. The Four Horsemen of Decline, Major Threats to Longevity. 1. Discussing the primary causes of death and diminished quality of life, Dr. Adam Peterson avoids dry medical terminology. Instead, he uses a vivid metaphor: the Four Horsemen of Decline. These represent the four most prevalent chronic diseases silently stripping away the health and vitality of modern individuals. Cardiovascular disease, especially atherosclerosis, cancer, neurodegenerative diseases such as Alzheimer's and Parkinson's, type 2 diabetes, and metabolic disorders. These are not only diseases with high mortality rates, but also the leading causes of a severely shortened health span. Peterson emphasizes that most of these conditions don't emerge suddenly. They accumulate over decades before manifesting. The problem is that we often wait for them to appear before initiating treatment, by which point it's usually too late. Crucially, all four horsemen share a common characteristic: they are entirely preventable if detected early, and if lifestyle changes are adopted soon enough. This is why he strongly advocates for a proactive healthcare system, a version of Medicine 3.0, where doctors and patients collaborate early on to halt these adversaries before they even have a chance to attack. The secrets of centenarians and why they might not apply to you. Adam Peterson once delved deep into researching individuals who lived to be 100 years old, centenarians, with the hope of uncovering a natural formula for extending life. However, the results were quite surprising for many. He discovered that centenarians didn't live long due to strict diets, rigorous exercise routines, or consistently getting 8 hours of sleep each night. On the contrary, many of them smoked, drank alcohol, were sedentary, and ate less than healthy diets. So what contributed to their longevity? Their superpower was delaying the onset of illness rather than avoiding it entirely. Specifically, severe chronic diseases like heart disease, cancer, or Alzheimer's arrived 20 to 30 years later for them compared to the average person. Yet, according to Peterson, this isn't something you can train for. It's inherited, a biological stroke of luck not bestowed upon everyone. The doctor stressed, centenarians aren't healthy because of their lifestyle. They're healthy in spite of it. Does that mean we have no hope? Absolutely not. Dr. Peterson asserts that even without possessing their miraculous genes, we can mimic their health-sustaining effects by utilizing the tools of exercise, nutrition, sleep, and stress management. The key is to proactively create disease delay through our daily lifestyle choices. Just as genetics have blessed centenarians, exercise, the most critical tool for longevity and quality of life, find the entire pursuit of longevity. If Dr. Adam Peterson had to choose the single most effective tool, it would be exercise, not medication or superior genes. He states unequivocally, exercise is the most potent intervention. humans can undertake to extend both lifespan and healthspan. Why is exercise so profoundly important? Extending lifespan. Individuals with high muscle strength, significant muscle mass, and excellent cardiovascular fitness have a substantially lower risk of mortality, even if they have risk factors like smoking, diabetes, high blood pressure, or kidney disease. Protecting brain health and preventing cognitive decline. According to Dr. Peterson, no drug has been shown to prevent Alzheimer's more effectively than regular exercise. Maintaining independence in old age. Do you want to go grocery shopping on your own, bathe yourself, hold your grandchildren, or travel at 85 years old? Then your body needs to be trained starting in your 50s and 60s, otherwise, it won't have the capacity to do those things later. So, what's the right way to exercise? Dr. Adam Peterson doesn't advocate for extreme training, but he emphasizes that exercising incorrectly or too little won't make a sufficient difference. The ideal exercise protocol includes strength training, at least 2 sessions per week, helping maintain strong skeletal muscle and preventing falls in older adults. Cardiovascular training, both low and high intensity are needed. 80% of the time should be at a light intensity where you can talk during exercise, like a brisk walk. 20% of the time should be at a heavy intensity, where conversation is impossible, like sprinting or HIIT. Nutrition. It's not about the diet, but how you control energy indicator. Adam Peterson was once a prominent advocate for the ketogenic diet for an extended period, but he later shifted his perspective, not because keto was wrong, but because he realized that nutrition shouldn't revolve around the name of a diet, but must be based on the body's biology and biochemistry. The core of nutrition, energy management. The most crucial question isn't whether you're following a keto, low-carb, or plant-based diet, but whether your body is absorbing more or less energy than it needs. Dr. Adam Peterson refers to this as the problem of overnourishment, the body taking in too much energy relative to its demands. This is the root cause leading to obesity, insulin resistance, type 2 diabetes, high blood pressure, elevated cholesterol, and metabolic disorders in general. The challenge is that most of us don't realize we're over-consuming because this process unfolds subtly, slowly, over meals, weeks, and years. 3 effective strategies for energy control. Dr. Peterson outlines 3 main approaches that can help you reduce your total energy intake, thereby reversing disease risk. Direct caloric restriction, monitoring food intake, clearly reducing portion sizes without necessarily changing food types or meal times. Dietary restriction, eliminating or significantly reducing a food group like sugar, refined carbohydrates, or certain fats, e.g. keto or low carb. Time-restricted eating or intermittent fasting, eating within a fixed window, e.g. an 8-hour eating window with 16 hours of fasting helps reduce overall intake without the need for calorie counting. No single method is optimal for everyone. Each person needs to experiment, listen to their body, and avoid blindly following trends. Sleep, the underrated medicine with profound impacts on longevity in modern society. Sleep is often undervalued. People praise working through the night and celebrate productivity over rest. But for Dr. Adam Peterson, this perspective is a serious mistake. He poses an intriguing question. Why has evolution preserved the peculiar behavior of humans, being unconscious for 1/3 of their lives? Modern scientific evidence confirms sleep consolidates memory and learning ability. It supports brain function, slowing neurodegeneration. It directly impacts insulin metabolism and weight control. Poor sleep also increases the risk of obesity, type 2 diabetes, and depression. Lack of sleep sabotages all efforts to improve health. You can eat cleanly, exercise regularly, and manage calories well. But if you consistently sleep less than 6 hours a night, you're undermining all the progress you've made. Poor sleep can disrupt hunger hormones ghrelin and leptin, making you eat more, increase insulin resistance, raise the risk of diabetes, impair neural flexibility leading to sluggish moods and reduced creativity, and negatively affect cardiovascular health and muscle recovery after exercise. From clinical observations and research data, the doctor provides a simple yet clear recommendation. Adults should aim for 7 to 8 hours of sleep per night. It's not just about quantity, but also quality, deep, uninterrupted sleep. Sleep must be treated as a priority goal in any longevity strategy, on par with exercise, nutrition, and stress management. Healthcare system reform, from treatment to prevention. Adam Peterson doesn't just focus on individual lifestyle. He also asks a bigger question: is the current healthcare system truly helping people live healthier and longer lives? His answer is no. Current medicine waits for illness to occur before treating it. The healthcare system Dr. Adam Peterson calls medicine 2.0 operates on a reactive model, waiting for a patient to have a heart attack before prescribing cholesterol medication, waiting for blood sugar to spike before giving insulin, waiting for memory decline before ordering a brain scan. All these approaches are behind the curve. We're playing catch up with disease and often losing. New medicine, proactively preventing disease 20 to 30 years ahead. Dr. Peterson argues that to truly live long and healthy, medicine needs to shift from medicine 2.0 to medicine 3.0, a system that predicts risk early, intervenes at the root, and focuses on personalization and lifestyle. For example, instead of waiting until age 65 to detect Alzheimer's, measure APO at age 40 to assess risk. Instead of prescribing insulin for type 2 diabetics, intervene with dietary changes and exercise as soon as insulin levels start rising abnormally. Instead of waiting for symptoms to test, regularly measure key biomarkers from middle age onward. Dr. Peterson's biggest message is that you cannot wait until you're sick to start living healthy. 1311. Every decision you make today, what you eat, how you exercise, when you sleep, is writing your health record 20 years from now. 3 crucial tests everyone should get as early as possible in the medicine 3.0 model that Dr. Adam Peterson champions. Predicting and preventing disease very early is a key factor. To achieve this, testing isn't just for the sick. It's a vital tool for healthy individuals to maintain their well-being. Dr. Peterson proposes 3 important blood and genetic tests that everyone should be aware of, even if you are currently in perfect health. APOB, the cholesterol marker. You truly need to pay attention to. Most people only know about LDL cholesterol. But according to Dr. Peterson, APOB is a more accurate indicator for predicting cardiovascular disease risk. APOB represents the number of lipoprotein particles carrying cholesterol in the blood. Not just the amount of cholesterol, it's the number of these particles, not the amount of cholesterol within each particle, that causes damage and plaque buildup on artery walls. High APOB means a higher risk of heart attack, even if total cholesterol might appear normal. LPA, the invisible genetic killer lipoprotein A, abbreviated as LPA, is a genetic cardiovascular risk factor that is not influenced by diet or exercise. It only needs to be measured once in a lifetime because your genes don't change. If your LPA is high, you need a proactive risk reduction strategy early on. Even if you currently have no symptoms, approximately 20% of the population has abnormally high LPA levels without knowing it. APOE, the gene predicting Alzheimer's and heart disease risk. APO is a gene closely associated with risk of developing Alzheimer's, ability to metabolize fats and cholesterol, the body's response to oxidative stress. There are 3 main variants: ApoE2, ApoE3, and ApoE4. Individuals carrying ApoE4, especially to copies E4, have a significantly higher risk of Alzheimer's and cardiovascular disease. These 3 markers are not typically included in standard health checkups. However, according to Dr. Peterson, they should become the new standard because they detect risk when you are young and still asymptomatic. Emotional health. If you're not happy, what's the point of living long? Dr. Adam Peterson, despite being a data-driven and scientific-minded individual, concludes his book Everlast with something seemingly unscientific: emotional health. He asks, if your life is filled with dissatisfaction, loneliness, anger, or meaninglessness, is living an additional 30 years truly worth it? Many people meticulously optimize their physical health, eating right, exercising diligently, regular biological checks, but overlook something equally important. They lack close relationships. They have no clear life purpose. They overwork, without time for connection, love, or healing. 3 pillars of emotional health you need to invest in. Purpose. What are you living for? What makes you wake up each morning without an alarm? Having a clear life purpose helps people combat depression, stagnation, and even extends longevity. Relationships. Close, meaningful relationships are the strongest natural preventive medicine. Research shows that people with strong social connections live longer and healthier lives. Emotional management and therapy. Do you know how to process stress, trauma, or painful memories? Are you brave enough to seek help when your mind is troubled? Dr. Peterson emphasizes that just as you can't build muscle without training, you cannot heal your mind without mental exercise and accepting professional support. In conclusion, do not trade emotional well-being for anything. Scientific data is beginning to catch up with human experience. Depression, loneliness, and chronic stress increase mortality risk just as much as smoking. Negative emotions exacerbate all chronic diseases. Dr. Adam Peterson believes that if you are not happy, you have no reason to live long. And if you don't invest in your emotional health, all your impressive biological metrics will become meaningless.